Hi, I'm Shivan Sarna, and today we're going to talk about your crotch. Well, sort of. It's going to be your pelvic floor. Very unprofessional, Shivan. Yes, but I'm supposed to say something catchy and hooky in the first 6 seconds of the video in order for people to stay listening. Ugh, yuck. Anyway, the bottom line is your pelvic floor plays such an important role in your health. And that's an, obvious statement if anything's ever gone wrong with your pelvic floor. If you've been living a happy, healthy life, and nothing has been up with your pelvic floor, then I say blessings to you, and may you never pee when you laugh. There you go. That's my holiday toast from now on, everybody. Let's have some fun today. It's a topic that's super important, and whether it's incontinence or whether it is SIBO can be contributed to by pelvic floor imbalances and disruptions. It just covers a lot of territory, and it's not something I think people feel comfortable talking about regularly. That's why I'm kind of trying to break the ice a little bit. And I also know that in the silent stillness of your bathroom, when you realize you have a pelvic floor imbalance, it is one of the loneliest moments you can experience. And I say that from my own personal experience. Now, fortunately, I have had support and I've figured stuff out and we're good to go, but it's a scary moment. And also, if you know an elderly, and this can happen to men too, but an older person, it's like the pelvic floor is one of the first things to go. And I want to help everyone make sure that they have a healthy pelvic floor. They say the big toe and the pelvic floor, when those start to go, you really age more rapidly. That is depressing. Let's get hopeful and let's get some answers. Dr. Jeannie Achuff is here, and her practice is in Canada as well as California. And her whole specialty is pelvic floor health, and also reproductive health, and also midwifery, and she really is a specialist in the area of this. And we want to thank Microbiome Labs for sponsoring this presentation. Let's go. Hi, Dr. Achuff. Hi.
Hello, Shivan. Thank you so
Hi.
much for having me. These are always very fun conversations, so
Very good.
appreciate the introduction. So today's talk is called Resilient to the Core, the Gut-Pelvis Connection in Women's Health. And as Shivan noted, I'm a naturopathic doctor by training. My training included midwifery, and so I've been very passionate about women's health and also developmental health, right? We look at what happens in the preconception stages, what happens during pregnancy, what happens then during childhood, and how does that set us up, particularly as females, for a healthy life and future, and potentially reproductive life if that's what we're seeking as adults. The microbiome plays a huge role in all of this, and so I'm excited to chat about that today. My practice, as Shivan noted, also has included a lot of pelvic floor fascia release work, hands-on therapy, a lot of things that border into the physical therapy realm. So this is an area I just love to talk about and support people through any challenges they might be having.
All right, I'm gonna hide myself and let you take over the screen. I am not going anywhere, everybody. I am just turning off my audio and video. Sorry to interrupt you. I will be here monitoring the Q&A box chat. Try to put into the Q&A. Okay, peace.
And hopefully you guys can all just see my screen, my intro screen. So I am also a clinical science liaison for Microbiome Labs. So this aspect of my life and career allows me to dive deep into the microbiome, which is a very exciting realm these days. There are almost 2,000 articles published globally every month on the microbiome. So if you like to nerd out, there's plenty of nerding out available for you. What we're going to look at today in this webinar is how does microbial diversity support a healthy gut barrier? What are keystone species and what do they do? And then how does this keystone population support resilience across the gut-pelvis axis? Now, I had a conversation with my computer earlier about changing slides on me. Bear with me, I hope it doesn't do that again. So we'll also look at what are gut organ axes. This may be a new concept for you. And we will discover how dysbiosis drives conditions like endometriosis and PCOS. And we'll bring it home with a conversation about MegaSporeBiotic, which is a Microbiome Labs, the Microbiome Labs flagship product, and how that can support this intricate ecosystem. Okay, this slide is a hefty one. We are looking here at the contrast between a healthy gut and a dysbiotic gut at the cellular level. So what you see there, the greenish area on top, that one is what's called the intestinal lumen, so the inside of the tube of the intestines. The squiggly lines are the intestinal cell walls, and then what you have on the bottom is depicted where the blood is flowing past the intestines. And we can see what kinds of cells and debris are able to get into the bloodstream depending on what's happening in the gut. So this graphic provides this nice depiction of the healthy versus the dysbiotic gut, helping us to see why that gut barrier integrity is so important. On the left, there's good microbial diversity. So we have beneficial bacteria playing a role in maintaining balance. The pathogen levels are low. It doesn't mean that we have no pathogens, but they are low and they are controlled. So that means that the beneficial microbes are outcompeting the pathogenic species. The mucosal barrier is strong. So this acts as a first line of defense against anything getting into the bloodstream. And the tight junctions between the intestinal cells remain intact. So that means there is no leaky gut pattern in those cells. Overall, there's a low level of inflammation in this system. By contrast, on the right, we see what happens when that gut barrier breaks down, which is referred to as leaky gut. On this side, we have low microbial diversity, which means that there is more potential for the mucus degrading and toxin producing pathogenic species to prevail. The mucosal barrier is inflamed, it becomes degraded, and those junctions between the intestinal cells become weak, leading to leaky gut. And this allows substances, particularly one called lipopolysaccharides, along with other bacterial byproducts, to be able to pass through those intestinal cell walls. When this happens, this triggers immune activation, low-grade systemic inflammation, and there are inflammatory cytokines that begin to circulate throughout the body. So this can lead to a host of different conditions, including what we call metabolic endotoxemia, which can contribute to IBS, autoimmune conditions, metabolic disorders, neurological issues, and today's focus, pelvic and reproductive imbalances and disorders. Let's take a moment to look at what is a lipopolysaccharide and why do we care? So we call lipopolysaccharide, abbreviated by LPS, an endotoxin. So this sits within the cell walls of gram-negative bacteria. It has many functions, so it's not just out there causing trouble. It binds and it signals, it's part of different metabolic processes. Now, most bacteria within our gut microbiome are gram-negative species. During the process of eating, this increases the turnover of bacteria, which causes more LPS to be released and enter the bloodstream. So if you didn't quite get that, eating causes bacterial die-off, and that can contribute to this low-grade chronic inflammatory state, courtesy of LPS. So we are what we eat. Obviously, diet plays a big role in the toxigenicity of these endotoxins. So the diets that would promote more LPS release are going to be diets high in saturated fat, particularly. So when you are lacking those omega-3 and omega-6 fatty acids, that is a large driver behind the production of these LPS molecules. Now, there we go. In this slide, this is just to emphasize the importance of microbial diversity in the gut. So we don't just have gram-negative bacteria. We've got lots of different species. In the gut microbiome, diversity is really important. This is the only organ system where we want to see dozens of different organisms. So there's a small overlap in the organisms we see in the mouth and the gut. It's actually almost close to 50%. Different families of bacteria dominate in different regions of our digestive system. So what we see in the mouth is going to be different than what we see in the descending colon. Once we get into the gut, though, we want to have a healthy population of organisms that will then support the microbiome of other areas of the body, such as the vaginal microbiome. In the vaginal microbiome, we want far less diversity than what we have in the gut. The group of organisms in the gut, being diverse, helps to seed the microbiome in other organ systems. And they help to direct what's going on metabolically. And this helps to maintain a proper environment throughout our microbial system. What we have in the gut are keystone species. So keystone species are very central. They're not necessarily high in numbers, but they are critical as far as how they affect the function of the gut microbiome and then how that ripples out into the rest of our system. So some examples of keystone species are the bifidobacterium species, which you may have heard of if you've looked at any bottle of probiotics. The bifido species in particular are important during childhood. So these are the species that are present and should be thriving in our early childhood years. A healthy bifidobacterium population sets us up for a healthy microbiome throughout the rest of our lives. And this is part of why we really encourage breastfeeding whenever possible, because the breastfeeding process helps to set up a healthy bifido population, which then helps to grow a healthy microbiome from there. Other species, one you may not have heard of, called Faecalibacterium prausnitzii, and then Akkermansia, which is coming into popularity. Some of you may have come across that species. So these are some of the key players in our keystone group. Now, the short chain fatty acids that are produced by keystones are primarily butyrate, acetate, lactate, and propionate. So keystones are largely responsible for producing the short chain fatty acids. What this helps, well, we'll talk about short chain fatty acids in a moment, actually, but one of the other functions of the keystones is also to produce and maintain a healthy pH. So throughout the gut, it changes a little bit, but the average is a pH of around 6. So it's slightly below alkaline. We want it to be a little bit more on the acidic side. And that acidity helps to prevent some of the pathogenic species from being able to take up shop and make a comfy home in the intestines. Now, when it comes to the female reproductive tract, I mentioned that the keystone species in particular, but also just a healthy, diverse gut microbiome is really important for seeding other organ systems. So we want that diversity. We want the proper pH, the proper environment. How does it actually happen? What's the connection between these systems? There's very interesting research that's laid out and titled this relationship as the female reproductive tract organ axis. It looks at the bidirectional relationship between these two systems. So largely, yes, the gut is driving what's happening in the vaginal tissue and the reproductive organs, but there's also a feedback. So there's signaling between all systems. And there's also relationships between the bladder, the brain, the gut, and even oral and joint microbiomes as they relate to the vagina, the vulva, and the cervix. Now, we also have more studies increasingly every year that are done on the uterine microbiome, and that comes up a lot in fertility. So for any of you who've done fertility work or who work in that realm, increasingly fertility clinics are testing the microbiome in the uterus. Now, where that can be a little bit concerning is the paradigm there is if you find something that's out of balance, give it an antibiotic. Not necessarily the best way to set up for pregnancy and a healthy microbiome in your child. Hopefully we can get there. So increasingly we are getting to that place where there's more understanding that the microbiome is really key. And the research is starting to really lay out some of these connections. The female reproductive tract organ axis being one of the primary focus. So the vagina gut axis has the most studies currently, and our understanding of this relationship is stronger than, say, what's happening between the reproductive tract and the brain, or, for example, the joint and vagina axis. Now, I think with all of the conversations that we're having around perimenopause and menopause these days, with women starting to really be more vocal about, hey, my joints don't feel the same way they used to, I think we're going to start to see more research come out in those realms. But for now, we're really looking a lot at what's happening in between the gut and the vagina, the cervix, the vulva, and the uterus. So typically, the female microbiome is thought of in the context of vaginal infections or dysbiosis, which can occur via antibiotic use. So, how many of us have had a yeast infection after having to take antibiotics, or lifestyle changes or stress levels. Common infections like yeast infections, bacterial vaginosis, the rate of infection in the female population is relatively high. Most of us encounter these experiences at some point in our life. And as it turns out, most people don't know this little factoid, but bacterial vaginosis is also associated with increased risks of urinary tract infections. It also can promote more infertility, fallopian tube dysfunction and inflammation, and adverse pregnancy outcomes, and even preterm birth. So dysbiosis in the vaginal tract is really important for those reasons, but also if we have dysbiosis in the vaginal tract, that can make us more vulnerable to sexually transmitted infections. And this does include HIV, HPV, which is responsible for genital warts, herpes, chlamydia, and gonorrhea. So a healthy vaginal microbiome is really, really important for multiple reasons. What does that look like? So as previously noted, this is not a very diverse microbiome, and that is good. That's how it maintains health and balance. So during the reproductive years, the vaginal microbiome is slightly different than it is going to look, and then the constitution will be pre-reproductive years and post-reproductive years. We tend to have slightly more diversity pre-puberty and post-menopause. For the bulk of our lifetime, however, what we're looking at is ideally a dominance by lactobacillus species. And these key species are Lactobacillus crispatus, Lactobacillus gasseri, Lactobacillus jacynii, and Lactobacillus einers. And these strains of lactobacillus help to maintain a low pH, which means it's acidic. And that acidity is important to create, again, similar to the gut, an inhospitable environment for the pathogenic yeast and bacteria, including the sexually transmitted infections. So vaginal health is a crucial component of women's overall well-being. Maintaining this ecosystem protects us from infections, as I noted, the infections can lead to pain and inflammation deeper in the pelvis and lead to scarring and tissue damage and fertility challenges. So what contributes to a healthy or dysbiotic vaginal environment? Genetics certainly can play a part. We do see health disparities among racial groups, and some of that is a genetic predisposition. So people being more vulnerable to vaginal and reproductive issues, including things like fibroids, endometriosis, PCOS. Of course, most of us know by this time that research backs the fact that we should be wearing cotton underwear. The synthetic fabrics next to the vaginal tissue can promote dysbiosis. Tampons also can be a culprit of dysbiosis, and they've actually found that menstrual cups are associated with a more beneficial environment. So that's another plug for using tampon alternatives when possible. And then we also have to consider environmental toxins, stress levels, medications like antibiotics. With the stress, elevated cortisol levels can change what's happening in the pH of the vaginal tissue. So that's something to consider as well, that managing your stress ultimately is also good for your vaginal health. So our gut health, as noted, is also a primary driver behind creating a healthy vaginal microbiome. Gut dysbiosis often correlates with vaginal dysbiosis. And I will say I have never seen a case of vaginal dysbiosis that did not include gut dysbiosis. So dysbiosis in the gut and the reproductive tract disrupts normal immune function, not just locally. That disruption can lead to elevated pro-inflammatory cytokines throughout the body, including in the peritoneal fluid. So for those of you who are not familiar with that term peritoneal, that is the region throughout the pelvis. So kind of you could think of it as like the pelvic cavity, or some people call it the pelvic bowl. Shivan noted the pelvic floor, right? So that's often referring to the muscles that are really supporting all of the pelvic organs. So that peritoneal fluid is the fluid that is not only around the uterus and the ovaries and the fallopian tubes and the vaginal canal, but also around the GI tract. So they're all literally swimming in the same soup, and that matters. So when we have these pro-inflammatory cytokines, they are affecting the reproductive organs essentially by saturating those organs in irritants. And unfortunately, there's a positive feedback loop where the inflammation that is there promotes more inflammation, even in the absence of infection. So these pro-inflammatory cytokines can be a part of the endometriosis pathogenesis, the development of the disease. And it is known to also contribute to fertility challenges. So essentially what we're saying is when there's dysbiosis in the gut, it literally is rippling out into the physical space in which those organs occupy and can affect neighboring organs, i.e. the reproductive tract. So backing up a little bit back to the vaginal canal specifically, often since BV and yeast infections are so common, we notice them when the symptoms arise, but we may not be aware of when something is out of balance if there are no symptoms. So while the symptoms are very important to address, of course, for our sanity, and they impact our quality of life, it's easy to overlook the deeper underlying health risks and the cause behind that vaginal dysbiosis. Our system gets caught, our medical system, our medical paradigm gets caught in chasing the symptoms. If the infection goes unmanaged or mismanaged, in my opinion, that would be not addressing the root cause. There's a potential for it to lead to more serious pathology. So urinary tract infections, potentially endometriosis, pelvic inflammatory disease, toxic shock syndrome, sexually transmitted diseases, fertility challenges, poor pregnancy outcomes, as noted previously. The vaginal tissue is exposed to a variety of different pathogens in our lifetime. So there's relative, risk throughout these reproductive years. The gut is an important driver behind not only the health, but also the resilience of this system. Now, just for those of you who like numbers, it is estimated that around 21.9 million women in their reproductive years will be affected by bacterial vaginosis. And the kicker is that the relapse rate is around 80%. So consider that and everything else on this list potentially not being properly addressed. And you realize that we're probably grossly miscalculating the number of women that are suffering, not only locally in the vaginal tissue, but also throughout their pelvic system. So clearly the root cause of the issue is not being addressed. As with so many other areas of medicine, at least historically, and I hope and think this is changing, this organ system has been siloed as though it exists in isolation. And, as I said, the research on the microbiome is beyond abundant at this stage. But we're starting to see a lot more research being done on the female microbiome. And so I think this is coming, but research tends to precede clinical practice by 10 years or so. Hopefully we're getting better at that too. But so this is just a nice little depiction, kind of comparable to what we saw at the beginning with our gut lining, showing a healthy reproductive microbiome versus one that would be potentially diseased or out of balance. So this is just noting, similar to the gut, we're going to have more short chain fatty acids, better lipid metabolism, higher population of the lactobacillus and bifido species in the healthy uterus, which means a decreased risk of infections and systemically increased insulin sensitivity. On the right side, we see more of the pro-inflammatory strains of bacteria, which means there's more inflammation, not only in the reproductive system, but also in the gut. Higher production of LPS, those lipopolysaccharides that are causing systemic inflammation. And without the proper keystone species balance, we're going to see fewer short-chain fatty acids and an overall risk of infections locally and globally, along with insulin resistance. Now, specifically,
Dr. Achuff, can we just have a moment here?
sure.
Um, I just want to say, I just really want that to soak in. Insulin resistance, which is so like an epidemic of it. And you're tying that to this. And I have to say, I wasn't expecting you to tie it to this. And thank you very much for doing that. But for those of you who are like trying to figure out, should I be on a GLP-1? You know, Alzheimer's is, the third diabetes, diabetes type 3 or whatever, and all of that. So I just want to just put a punctuation mark behind that because it's not talked about enough. So please share that information with your friends and family. Love you.
Yeah, and that is a really nice way of tying this all together. So, as noted before, sometimes women are having vaginal issues, right? They're having vaginal microbiome issues, not recognizing, as I just said a minute ago, that this, we're not looking at this organ system as being connected to everything else. But if you've got dysbiosis there, you've got dysbiosis in the gut. And if you've got dysbiosis in the gut, you are set up for more inflammation, metabolic challenges, I will say. There's genetics that play a part in that too, but insulin resistance is a huge factor. So there are a lot of things that can contribute to it, but remember that all of these expressions in different organ systems can point us back to, hey, there's something going on centrally in the gut microbiome, and that could be driving all kinds of patterns throughout the system that are not optimal. So yeah, it is all connected. And I can go off on all kinds of directions. So, so I wanted to tie in two specific conditions that really are, I would say, and I actually, should have looked at the statistics on this, but from a clinical standpoint, I see more endometriosis and more PCOS now than I did 20 years ago when I started my practice. So, I have different ideas as to why this may be happening. But I do think that the microbiome is playing a big part in the clinical manifestation of these different pathologies. So lots of really amazing research that's coming out on endometriosis and dysbiosis. I would not say from the research that I have read at this point that we have really hard conclusions around like these organisms are driving it. This is how it happens, right? There's a lot that goes into this disease pattern and a lot of different expressions of endometriosis. So we're still learning, but there is a very clear link between endometriosis and the microbiome. So just a little bit more on the subject. For those of you who don't know, it's a chronic inflammatory condition. It leads to pain, extreme pain, adhesions in the pelvis and potentially throughout the body, hormone disruption, and that inflammatory process can affect all kinds of organs outside of the reproductive system. Endometriosis involves immune-mediated changes in the pelvis and throughout the body, and that's part of where the microbiome comes in. So what we do know is that there's a reduction in the abundance of the beneficial bacteria in people who have endometriosis, and they tend to have more pro-inflammatory organisms. There does tend to be a higher rate of leaky gut, and then also LPS from the gram-negative bacteria getting into the bloodstream. And that activates some of these pro-inflammatory cytokines like we discussed at the beginning. And of course, there is the hormonal factor in endometriosis. So what we see, there's the concept of what's called the estrobolome in the microbiome. I'll say that again for those of you who haven't heard that word. Estrobolome. So it relates to the word estrogen, and then the bolome is related to the microbiome. So it's essentially how is the microbiome contributing to recycling estrogen within the body. We'll talk about that again in a moment in the context of PCOS. But this recycling of the estrogen can effectively expose more tissues to more estrogen than is physiologically healthy. And that can promote some of the inflammation and the pathogenesis that we see in endometriosis. So literally, I could give a 2-hour talk on this. This is one of those places where we could just go and go and go. But just remember the bottom line is that the gut microbiome, and therefore the immune system and the endocrine system, are all playing a part in the pathogenesis of endometriosis. The next one is PCOS. So PCOS is not just an ovarian condition. It is a systemic, metabolic, and inflammatory disorder. And what we can see is that the gut microbiome does appear to sit upstream of this pathogenic process, both with the insulin resistance aspect and the androgen excess aspect. So the androgens are the male associated hormones, right? There's better ways of explaining that, I think, because now we all have an understanding that we all have all the hormones. But when we think of the processes that drive more of the male physical traits, the androgens are responsible for those. So hirsutism on this list, it would be like facial hair. And then changes to body composition, courtesy of the androgen excess. The androgen, so think of testosterone, right, is affecting the body's ability to ovulate. And this imbalance in not only reproductive hormones, but also insulin contributes to a significantly higher load of inflammation throughout the system. So in regard to dysbiosis, the gut microbiome regulates estrogen recycling via the estrobolome. So the estrobolome is the collection of microbes that help to recycle and recirculate estrogen the estrogen that's made its way to the gut. In PCOS, there is an altered estrobolome activity, which means it's not what is typical. It can be elevated or it can fluctuate. And this changes the balance of circulating estrogen. That also is going to disrupt the signaling of other hormones, namely LH, which is luteinizing hormone, or FSH, which is follicle stimulating hormone. So through these pathways, the microbiome is essentially modulating the body's hormonal environment. Further to that, the hyperandrogenism, so that elevation of hormones, particularly testosterone, which is seen in PCOS, can in and of itself perpetuate microbial changes. So we have these multiple feedback loops in PCOS between the endocrine system and the gut that can become like a runaway train. This is part of why I feel passionate about paying attention to the gut microbiome in children and girls who are heading into puberty, but ideally who have not entered puberty yet. Because if we can get ahead of these microbiome changes before they start to affect the reproductive system's development, we're going to be doing a lot better. So, I look back at kind of what was going on in my life. I was a swimmer. And I'll say this is on my website too. I'm not shy about this, but I have endometriosis. And I look back at my life. I grew up in a hyper clean household. I basically was bathing in chlorine for most of my days. And I had a lot of, I would imagine, a lot of dysbiosis. I also have celiac disease. So when I think back and it's like, man, what could have been different if when I had been 8 or 9 years old, this information was known and could have been addressed and perhaps, potentially set my system up differently. So as we talk about these relationships between the gut microbiome, and as I said earlier in the talk, certain patterns potentially could lead to endometriosis. I'm not talking about someone who's 35 years old experiencing dysbiosis and then suddenly developing endometriosis. This is a long-term development that often starts in childhood or in early adolescence. So preventive medicine through the microbiome. What do we do about this? Shivan, I know I'm talking a little slowly, so I'll pick it up here.
Okay.
So
we have a lot of questions. I just want to make sure we have time for it.
Okay, yeah. So how do we create an environment that can shift this picture? As noted previously, supporting healthy keystones so that we get a really nice production of short chain fatty acids. Butyrate in particular helps to suppress 2 specific cytokines called TNF alpha and IL-1 beta, which are those pro-inflammatory cytokines. It also inhibits another pro-inflammatory cytokine that is associated with genetic programming. This one is NF kappa beta. And this one is, when butyrate inhibits that one, it essentially helps to turn down the genes that promote inflammation. And then together, propionate and butyrate help to keep inflammation down in general, which in the pelvic cavity specifically, which helps to reduce the potential for cramping and pelvic discomfort. So gut dysbiosis is being expressed by the vaginal tissue and microbiome. When the gut's out of balance, inflammation prevails. And when inflammation in the gut prevails, it affects the entire abdomen and pelvis with this increased inflammatory activity. So those pathogenic microbes translocate to the vagina rather than the healthy species that we want to be translocating, like the lactobacillus species. So when that happens, we are, again, promoting a more vulnerable environment where the pH is too high and the foreign species can take up shop. So again, the conditions, thinking of yeast infections, BV, a history of antibiotic use, and a history of any of these other conditions, or people who are trying to conceive, or they're recovering from just having had a child, or are going through other hormonal transitions in life. It starts in the gut. So as I mentioned before, Microbiome Labs has this product called MegaSporeBiotic. This was the first product produced by the company, and this is why the company started. This is an all-spore antioxidant producing probiotic. It's the first of its kind. It's been around for over a decade. MegaSporeBiotic is designed to recondition the gut microbiome. So there's a lot of clinical research that supports the function of Megaspore to heal the gut barrier and support gut barrier integrity, and therefore supporting immune function. Another nice functionality of this formulation is that it does survive the upper digestive tract, and it is not does not need to be refrigerated. So it contains 5 bacillus spore strains. Each of these has its own metabolic capacity, ranging from production of vitamins and natural antibiotics to immune modulation, helping to support short-chain fatty acids. But also what I love about this formula is that it doesn't just do these things with the spores themselves, but the spores create an environment in which the keystone species that we want to be thriving can thrive. So it's like this guy comes in and helps to reorganize the community, supporting all of the big players that we want to be thriving. So how does it work? As I said, the strains have high survivability. In the spore form, they're able to survive stomach acid and the bile salts, and then they activate in the intestines when the pH shifts slightly. Once they get to the intestines, that's where they start to modulate the microbiome and then promote gut resilience. One really cool factor is that one of the strains, which we call HU58, which is available on its own, has the capacity to do what's called competitive exclusion, and it also releases various compounds that can help to essentially eliminate pathogens and species that shouldn't be there. So if a species, perhaps there's a species that should be present, but it's gotten, way too overzealous and it's taking over too much of the microbiome, this spore will come in and say, hey, your party's too big, we need to knock it off, and it'll bring it back into a more balanced place in the microbiome. The spores help to support gut barrier integrity, so helping to heal leaky gut and bring those tight junction proteins back into action and reduce the intestinal permeability. And when we do that, we are also reducing the leakage of the lipopolysaccharides into the bloodstream. So we have studies that show that there's a 42% reduction in metabolic endotoxemia. So we have evidence that proves that this is an effective player in gut barrier healing. It also helps to reduce inflammation. And as I said previously, increase the production of short-chain fatty acids, largely by producing or supporting the producers of those short-chain fatty acids, which is the keystone population. So this is not just a probiotic, but it is a reconditioning tool to help support a healthy microbiome. It's a little bit more about the spores. You guys are going to have access to these slides, so I will let you read that.
Not exactly, so we'll talk about that in a minute.
Okay.
Okay.
Okay, well, some of these are reiterations, but one thing I will note is that the spores are really wonderful for people who do have histamine type reactions. We always advise going low and slow, but these do not tend to cause any type of histamine response. So why choose spores over other probiotics? The other probiotics are really the expression of what's happening at the keystone or the root level of a microbiome. The spores are addressing that root. They're addressing what's happening with the keystones and what's happening with the functionality of the gut. So most probiotic studies show that probiotics, the various strains like the lactobacillus and bifidobacteria, not that they're not helpful, but they tend to focus mostly on GI symptoms. And that's where they're studied and symptomatically appreciated. A spore-based probiotic is getting to the root cause of disease. So you're going to notice differences not only in gut function, but also fertility, inflammatory conditions, as we talked about before, insulin resistance, even mental health scenarios. So when we connect the dots, using the spore-based probiotic, you may expect just the digestive symptom to improve because, hey, I'm taking a probiotic. But your symptoms throughout your body aren't necessarily, can be a product of an altered microbiome. So when you're taking the appropriate support for the gut microbiome, you will see an effect throughout the system, including improvements in menstrual cycles, decreased genitourinary irritation, and this includes postmenopausally, reduced symptoms of inflammation. A lot of people find that their food sensitivities are not as many or not as severe. Changes in skin, respiratory function, mood, and energy levels as well. So the gut microbiome acts as the control center for immune tone throughout the body, influencing inflammation and hormonal signaling. So when there's dysbiosis and leaky gut happens, then there's those inflammatory signals circulating throughout the pelvis. And this creates that pro-inflammatory environment that impacts the vaginal microbiome balance, can have a heavy impact in pelvic pain and irritation, including endometriosis and PCOS physiology, also fertility and pregnancy outcomes. So remember that pelvic health cannot be restored in isolation. Restoring gut integrity is foundational to restoring resilience in women's health. When we stop chasing symptoms in the pelvis and start restoring integrity in the gut, the entire system begins to calm. Thank you, MegaSporeBiotic.
Gorgeous. Thank you so much. Let's put some love into the chat for Dr. Achuff. I know that was a lot. That was fantastic. I learned so much. I know when I came on in the beginning, I really was just talking about the pelvic floor and I wasn't talking about the microbiome. But obviously, thank you for all this. When you can get that. So this is the thing, we take it for granted, right? Just like good skin or your hair or whatever it is. Things are going fine. We don't think about it. But when it's off kilter, holy smokes, it is so upsetting. Let's put some more love into the chat for Dr. Achuff. But thank you, Lynn and Leslie and Miranda. Did anyone have any aha moments? Like the thing about the metabolic, resistance, that was really, really powerful and really interesting and extremely motivating, right? Extremely motivating. What I want to do right this second, and I was going to turn off my camera, but I'm not, stop the recording. I'm just going to tell everyone this to please look in the chat because we do have 15% off on the Megaspore and actually everything at Microbiome Labs. Normally, and the very first time I wanted to buy some Megaspore back in 2016, I could not find a place to buy it. Couldn't find a place to buy it. I had to go to a practitioner into their office and get it. And through a special dispensation with Microbiome Labs and my community, I'm able to bring it to you and also with the discount. So if you look in the chat, what you see is the No Bloat 15 along with a link so that you can order it. And also, if you did decide to order anything from Microbiome Labs and send me the proof of purchase by 8 p.m. Eastern time tonight for today, and I'll give you the email address. I'm also getting you the Curing Chronic Urinary Tract Infections Part 1 and 2 by the incredible Ruth Kriz. And if you've come to any of our small group coaching for SIBO, you've heard me recently talk a lot about Ruth. She is a phenomenal expert for many decades on interstitial cystitis and urinary tract infections. She's consistently blown my mind with what she has observed, from genetics to pH levels to when to take the antibiotic, when not to take. La, la, la. She's genius. It's amazing. So that's $77 usually, and so that would be your gift today if you did decide to get something and send it to us by 8 p.m. Eastern time from Microbiome Labs. If you do get the vaginal or the stool tests from Microbiome Labs, it does not include an interpretation. Okay, just to be very clear, it does not include interpretation. You could bring it to one of your practitioners, but they do have tests there too. info@SIBOSOS.com. Okay, so that's the place to send it to. That's out of the way. Natasha, I don't know where to put the links if it's not in chat. You'll get an email. You'll get an email by 5 o'clock tonight, and that should work. Okay, I am going to get to some of these questions right now. Okay. All right, Jeannie, we don't have a lot of time, so we're going to make them short and sweet to the point. Nia, I would appreciate if you could offer any information support for naturally treating a uterine fibroid and occasional urine links. Thank you.
Yeah, so uterine fibroids can be very challenging. This is one
You can
area
come back
where,
full screen on your face too.
oh
That'd be
yeah,
great.
let's see.
Yeah.
Oh, how can I do that? This is tech, Shivan, or you want me to?
Sorry, you're doing great.
Here you go.
Stop share.
Stop share. Let's see. Got to get back to my. Here.
There you go. Okay, perfect. Okay, uterine fibroid.
Yeah, so fibroids can be very tricky. Once they have grown, they are stubborn buggers. That tissue is really strong. I have worked with patients absolutely in addressing fibroids and helping to reduce them. A lot of that comes from reducing the estrobolome activity and decreasing the estrogen recycling and optimizing the way that your body is metabolizing estrogen. But I have to say, in my clinical experience, oftentimes the best approach with fibroids, and I do not say this lightly, I am not one who recommends surgery by any means, generally speaking, but often the best approach is to have them surgically removed and be working with the root cause of what drove those to be produced in the first place, so that you can prevent further development of other fibroids, just because they're very, very challenging. I have seen people reduce them. It takes a lot of hard work and dedication, and really partnering with someone who can, help you keep your foot on the gas. So it's not impossible, but yeah, they're challenging.
Okay.
When it comes to urinary leakage, the microbiome plays a huge part. So I absolutely encourage you to look at, just look deeper beyond the pelvis and take some consideration into what's happening with the gut microbiome. A really good pelvic floor physical therapist or physiotherapist, depending on where you are, is gold. And I very much believe in someone who does not only the assessment of strength, but also fascial release, because a lot of times it's more of an issue of tension rather than needing to get stronger. You want someone who's paying attention to where is the strength and where is their deficiency, rather than just do some Kegels.
Yeah, don't be doing those Kegels without some supervision and some really strong advice, because they can really work against you. And pelvic floor therapists are doing God's work, and they can create really miracles in the body. I've had so many people tell me that. All right. Can you touch on inguinal hernias, if they connect to pelvic floor issues in any way? Is surgery with mesh the only path? Mesh being installed with that, I'm afraid of autoimmune and other things that can happen from a foreign object in the body. Great question. They're all great.
Excellent question. So if someone is recommending mesh to you, I encourage you to shop around. Mesh has really shown not to be optimal for a lot of people for some of the reasons that you cited, with irritation and potentially autoimmune reactions. Inguinal hernia, as far as being a product of the microbiome, that's very difficult to say. In some cases, sure, it could be a part of what's happening in the microbiome. And, we think about what's happening in the gut influencing the health of all of our tissues throughout the body. So if the gut's functioning well, we're absorbing nutrients well, that promotes good strength of tissue integrity. But sometimes a hernia is a product of more of a just kind of a postural or structural issue that really is a physical expression. I love the people who do like visceral manipulation or traditional like European trained osteopaths for helping with that, because I do think that surgery is not always the only option. But if surgery does become, the best option, absolutely look for someone who's not going to use the mesh, and partner your care with someone who will do some of that manual work while you're working internally with what's happening on the microbiome level, which is going to be very, very important if you have any kind of surgical procedure.
Big time. And if you want to find someone who does do visceral manipulation, look under Uplinger and Baral Institute, and they share a directory. Okay, is there any relationship between SIBO and chronic BV or yeast infection? So you actually answered this earlier. Yes is the answer. Are the microbiome sharing between sexual partners always at most a negative that can happen? Or are there any female reproductive trace microbiome benefits that could result from shared sexual activity?
Yeah, it's funny. I was actually thinking about this a couple weeks ago. Like, we all grew up in different environments, right? So what do we get from our sexual partners as far as, potentially exposure? Like, person I was with for over a decade is from the other side of the world, and grew up in a completely different environment. So, oral microbiome is obviously shared. That's one area where you do want to be careful, I would say. If your partner has a lot of like gum disease or is prone to cavities, things like that, they need to be doing their thing, but you really need to be supporting your system so that you don't become vulnerable to some of those organisms. And the gut health absolutely is being, there's a relationship there with the oral microbiome. So any probiotics that you're taking, even if you're not swishing in your mouth, will potentially have that reflection back up into the gut. When it comes to sexual organs and sex, basically any kind of genital contact, yes, we can absolutely be sharing beneficial species as well as potentially problematic species. So I often will, when I'm working with a woman who's having any kind of chronic vaginal issues, offer suggestions for stuff that their partner can do. And if it's a male partner, I have a penis wash recipe that's got antimicrobial herbs, and then I have them do probiotics applied topically, anything that we might be also using vaginally. So I do believe that managing both systems is important, both at that, organ level or tissue level of the sexual organs, but also, in the gut.
Also, they have done studies recently for BV that show when you have to treat the partner as well. And that they stopped the study because it was so effective. They didn't need to wait any longer. They're like, this works. And everyone say hi to Sadie. Okay, thank you.
Hi, Sadie.
Hi, Sadie. Okay. Hi, Georgia. When people have surgery, either to help identify endometriosis or remove it, how likely is the associated or worst outcomes regarding SIBO and dysbiosis due to the scarring or adhesions from surgery?
This is a great question. The official recommendations are starting to shift. We now have the OB, I don't know if it's been published or where this kind of came through, but they are, the gynecologists are accepting that you do not have to have the laparoscopic procedure to diagnose endometriosis anymore. They are accepting clinical presentation in and of itself. Great. So, from an insurance standpoint, or if there's something there where you need to have a documentation of, yes, I have endometriosis. In the past, they would require that there was laparoscopic evidence. But if you're talking to a gynecologist who isn't willing to give you a diagnosis based on just your clinical evidence, shop around, because a good gynecologist will understand those clinical symptoms and be able to say, yes, this is happening. As I said before, I'm not a huge proponent of surgical procedures whenever it's possible to avoid them. I opted out when it came to that laparoscopic diagnosis. This was 25 years ago for those reasons. And it's true. You can have increased scarring. You can have a lot of digestive irritation that comes from the procedure itself because of the way that they have to inflate the abdomen. So this is an area too where I think talking with some really well-informed clinicians in your area is beneficial, but also follow your gut. We really do have a sense of what's best for us. And if there's something that's saying, I don't think that the surgery is going to go well for me from a GI standpoint or, scarring or anything, trust it, and some people I've seen go into the surgery because they're like, I need this, feels right, I'm doing it. And they do great.
They do great. Yeah. We're not saying do not do it. She's saying follow your intuition, do your research. And I've asked Dr. Pimentel, a world-renowned gut expert out of Cedars-Sinai, about adhesion surgery in general. And he said that if you have the adhesions removed, not everyone grows new adhesions back.
Right.
So you have to look at that too. Okay, I have 21 questions and we are basically out of time. Okay, hi, Aressa. Thoughts about cytolytic vaginosis / lactobacillus, lacto overgrowth. Any thoughts on that as an imbalance accompanying SIBO or pelvic floor dysfunction? Before you say that, the answer, I also wanted to show you my favorite new development is that MegaSpore does, it said for kids on that graphic, but they do come in delicious gummies that do not have crappy ingredients in them, and they are vegetarian. So I just wanted to mention that for those of you who have pill fatigue. And you can also open the capsules and slowly titrate up. It's powerful. There's no doubt about it. It's powerful. Okay, what about the cytolytic vaginosis lactobacillus overgrowth?
This is an excellent question. So this topic of cytolytic vaginosis, essentially what happens, people will experience the symptoms that are consistent with either bacterial vaginosis or a yeast infection, and they go in and they get tested, and none of those exist. Not all clinics will assess for cytolytic vaginosis, but what's happening is you actually have an abundance of lactobacillus species. And as I said, these are responsible for keeping a slightly acidic pH. Now, what happens for some people, and I will say this, the research on this condition is abysmal, like abysmal. And a lot of clinicians don't even know that it exists. So when you go to look it up, you don't find much. But because of that overgrowth of lactobacillus, and when I say overgrowth, the question is, at what point is it overgrowth? Like, is it specific to an individual's tissues? Like, why does this happen? We don't know. But it produces too much acidity, which effectively, that term cytolytic means that the cells are rupturing. So it's too acidic for the cells themselves. In this case, I don't typically recommend more lactobacillus. We are looking at a different angle on the microbiome. Here's where I will typically recommend that somebody does a gut microbiome test so that we can better understand what's happening there. And it's really a fine balance, but probiotics are typically not the answer in that condition. And there's more of a systemic something happening with pH levels, nutrient to the tissues, and gut microbiome. And yes, does it co-occur with
get
conditions
something
like
from
SIBO?
Microbiome Labs today, but
oh, go ahead.
Yes. I think we had a little glitch there, but please get something from Microbiome Labs today so you can get those Ruth Chris masterclasses. She talks about douching. She talks about the pH. She's talking a lot about complementary things to what we're talking about today. Okay. I am so out of time, folks. I am so sorry. If we feel more comfortable using tampons, is there anything better than organic cotton tampons in terms of the local microbiome health?
If
You
you
talked about
are,
the disc or the cup.
yeah, if you're married to tampons, certainly organic and non-bleached and all of that stuff. But yes, I have friends who swear by that cup that auto dumps. There's there's the Diva cup, there's all kinds of options. But whatever you can do that is not going to, dry out or disrupt the pH of the vaginal environment.
Okay.
Yeah.
We did that one. Susan, I took the Biome FX vaginal test, which is the swab test at Microbiome Labs. The result was I have 100% strep B, algal, I don't know how to pronounce that word, AGALA. With the test results, I got recommendations for 2 oral probiotics, Bristle and Dental Flora. Those are both tablets. They include strep salivarius and lactosalivarius. These have been shown to eliminate strep B. But will these be able to get through my digestive system and actually be helpful? Well, she doesn't work for Bristle, so I don't want to have her necessarily put her on the spot there. Do you have any other suggestions for supplements and probiotics? Yes, Megaspore.
Yes, MegaSpore. We have data to show that the Vaginal Balance formula from Microbiome Labs does translocate. So, as Shivan said, I can't speak to those other formulas. I haven't seen their data. I don't know. But what I do know is that our Vaginal Balance formula does translocate. So that is an option.
Yep, and that's really kind of the point of what we've been talking about today. Is it possible to be on a high-fat, keto, paleo, carnivore diet without developing issues in the female reproductive area directly or indirectly through the gut, through the gut changes over time?
This is an excellent question, and I think very apropos for where we are in time with dietary conversations. Perimenopausal recommendations are high protein. The keto diet is celebrated. From a microbiome standpoint, I have a very hard time standing by those. When I look at someone's Biome FX report, when I'm looking at those microbiome compositions, I can tell you, even if you haven't told me what you're eating, I can tell you the tendencies that you have in your diet. And so I will see lots of the protein fermenting bacteria, lots of those LPS producing bacteria in abundance, and sometimes in overabundance when we have someone who's on either keto or paleo or carnivore diet. I don't think that it's the best option. It's not a very balanced way of eating. Could you still do high protein with, fiber forward? Sure. But I think that we are kind of throwing the baby out with the bathwater when we go to any of these extreme diets. So from a microbiome standpoint, I am very cautious.
Okay.
Yeah.
This is not a vaginal probiotic per se. Somebody's asking, etc. This is a systemic one that you saw what it does based on the presentation. They do have a vaginal support one and a pregnancy support one in there, so you can see it in the catalog. So the next question is, I'm not going to get to everybody, and I'm so sorry. Can I use yogurt, glycerin, flaxseed, and other things intravaginally to help positively change the vaginal microbiome? One question that I have for you is, are you taking a pH reading? Okay, go ahead.
Yeah, potentially those could influence the vaginal microbiome. It's certainly, it's hard to say. Would I recommend that as a clinician? Unlikely. And just remembering too that if there's something that's happening in the vaginal microbiome, it's because there's something that's being driven from deeper in the gut. So don't forget that aspect. But it does sound like the inclination is to try to keep things more sort of home-based or homemade. I can't say whether that will work or not, but theoretically speaking, you're exposing the tissue to some probiotics. So if nothing else, it's going to be soothing.
Okay. Yep. Okay. What bacterial strains are seen in the microbiome of postmenopausal women, and do we need to address those to have good health?
Yeah, so my question to that question would be, are we speaking about the gut specifically or the vaginal microbiome? I'm going to lean towards vaginal microbiome just because that's more specific to this time of life.
Yeah.
So we do see fewer of the lactobacillus species in a postmenopausal vaginal microbiome. That is physiologically appropriate. That said, we do still want these, species. Some of those could be bifidobacterium as well, but we want species that are promoting a more acidic environment. A lot of questions I think are coming up in various aspects of what do we want to maintain into our menopausal years that resembles, our reproductive years, and what is a physiologically appropriate shift. And so some of those things, that comes down to the microbiome, like, and hormones too, right? It's like, what are we meant to preserve and what are we meant to shift gears on? So the microbiome is meant to shift gears. That said, we do still want lactobacillus species there. We will see a little bit more microbial diversity, but I think it is important to keep seeding that population. And again, the healthier the gut microbiome is, the healthier the vaginal microbiome will be, even in those hormonal transitions.
That's me going, we're wrapping up. I'm sorry. That's not the universal sign. This is the universal sign for wrapping up. Let me just say this because I teach people about SIBO. You guys, Patricia, I'm so sorry. There's like a trust score verification comes up by SUPCO. Do you know what SUPPCO is? Jeannie, do you know what that is?
I do. Yes.
Okay.
Yep.
So when you click on the product, a trust score verification comes up by SUPCO. That's, I think, just showing that the website's legitimate. So that's what it is. It's like a stamp of approval. So when I teach people about SIBO with Dr. Allison Seebecker, she's the lead on that. But you have to think about this in so many ways, which you did such a great job describing. Chemically, right? Like hormonally, microbiome, the estrobiome, what's going on with your pH, mechanically, what's going on, your partner, the kind of underwear you're wearing. It is a multifaceted issue. And as I said before, when it's going great, it's great. And when it's not, it's a nightmare. It can be very, very disruptive. And UTIs, remember, if you have an elder adult who's declining mentally quickly, men and women, please check to see if they have a UTI. And definitely check out Microgen DX. I have a test kit around here. This is what it looks like. If you can test at home for UTIs, I have a whole box of test lab kits here. And they will culture for things that your normal urologist and gynecologist will not. And then give you information and suggestions for how to treat it. So it's another rabbit hole for those of you who are like, ugh, another thing. On the other hand, hope, because there are answers. There are people that are deeply, deeply involved in getting these answers to you after this area of the body, much like you said, separated from the rest of the body, like biological dentistry, taking the mouth out of the body, putting it over here and going, we will now deal with this totally separately. So it's a wonderful integration and it's a wonderful embodiment of the rest of our health. And I don't want you to be overwhelmed. Instead, I want you to be empowered. I think getting MegaSporeBiotic is a great way to get started. I think rewatching this, you're going to get the replay tonight, as well as if you do make a purchase, please let me know at info@SIBOSOS.com with your receipt from Microbiome Labs by 8 p.m. Eastern Time tonight, so I can send you the Chef's Kiss Ruth Chris double masterclass on interstitial cystitis and UTIs, covering pH, antibiotics, non-antibiotics, douches, all the whole bit. So this has been magnificent. Thank you so much, Dr. Achuff. Really appreciate you. If you wanted to work with Dr. Achuff, she is available to people who live in 2 places and does do telemedicine. And where are those 2 places?
California and British Columbia.
There you go. So those are options for you. And as far as if it says the product has no certifications, yes, it is okay. I don't know what that means. You know, I've been buying from Microbiome Labs since 2016 when I figured out how to do it. Okay, thanks,
lots of
Teresa.
quality control. Everything is safe.
Everything is safe. I know the owners of the company. It's a very, very safe situation. Yes, if you had a hysterectomy 25 years ago, it could be impacting UTIs today. But that's why I mentioned, like, it's not just that. It's just like if you're constipated, it's not just fiber, right? If you have SIBO, it's not just bloating, right? There's lots of it's a system. It's a system. And I just got to get Iona here. Sorry.
Okay.
I don't do well when I have questions that go unanswered. What about bidets? Leslie, watch that thing from Ruth Chris. It has to do with your pH. I noticed, wait, Iona. In the management of endometriosis, when there is suspected gut microbiota imbalance that may increase the activity of beta-glucuronidase and promote estrogen recirculation, do you typically incorporate strategies to moderate this pathway, such as the use of calcium D-glucarate, or, I don't think I said that right, or targeted probiotics to help reduce the hormonal recirculation and estrogen dominance?
Yes, yes, and yes. I use the DIM and calcium D-glucarate. I use them cautiously, especially depending on the age of someone. If they're perimenopausal, we don't want to be tanking estrogen, but yeah, so I use them with some scrutiny, but always looking at the microbiome and supporting the liver. So how is the liver able to participate in this? Is the liver detoxing adequately? So yeah, I do incorporate different therapy approaches, but the microbiome is the foundational aspect for sure.
I noticed vaginal microbiome tests take a while to get the results back. If we're in the heat of an acute condition, anything better than the UTI and other female reproductive over-the-counter kits sold like places at CVS. So Microgen DX does get you back the results within like 48 hours. They're really, you gotta, at FedEx overnight, they get it, and then they have to do their things, and then you get an email. But it's the fastest I've found. As far as over-the-counter places like CVS for the UTI, I don't know, but I do know, I don't know, and I'm sorry. I do know though, if you are using AZO, that thing for pain, the labs do not like it if you've already taken that and then send in the sample or do the test. Jeannie, and then bye-bye.
Yep. No, that's correct.
Okay.
And I don't know of any fast or vaginal microbiome kits, unfortunately.
Okay.
Yeah.
Okay. We love you. Thank you so much. We
Thank you for
will
having me.
see you on the other side. Thank you very,
Okay.
very much. This was fantastic. Please get this going. Question, how long do you think it takes before we notice a difference? And I know everyone's microbiome is different. So it's a shot in the dark because one person's may be decimated and the other person's maybe in pretty good shape.
Yeah. Yeah. And some people will respond very quickly to like, oh, something's been disrupted. So I will
Yeah.
also say start slowly, because for some people, your microbiome will go, what the heck just hit me? Start slowly, go, don't take 3 a day all at once. Some people notice differences really within a week. And some people, you're really at that like subterranean level of rearranging things. And so it's going to be like, make a symptom journal today and then check that symptom journal again in 2 to 3 months, because you're really affecting at a deep layer what's happening in the expression of your physiology. And it can take a little while.
And how does this work if you have yeast infections?
How does it work?
Like, does it help or hurt with yeast infections?
Oh, it absolutely helps.
Okay.
Yes. I
All
also
right.
will pair it with other therapies because yeast sucks. But
Yeah, it really does.
yes, in the big picture, it will steer you away from that pattern.
Right, because it's the estrobiome, which I don't think I said that right either, and that is made up of the bacteria, the viruses, and because it can be okay if the balance is right, right? You got to clean up the neighborhood, get the thugs out of the neighborhood, and harmony can come back to it. And that's why people always ask me, like, what do I do to recondition my gut after SIBO is gone? Yes, we love MegaSpore for that. And when the bad players are removed, the garden can thrive because the weeds or the meanies are gone. I have to go. Mwah. Thank you.
Hi, Shivan. Thank you.
Bye bye. Thank you so much. Thanks, everybody. See you next time.